Hello and welcome to That Deacon on YouTube. This month, I'd like to share with you an extended interview I had with one of our parishioners, Dr. William Babson. It's an interesting interview because Dr. Babson graduated from medical school in 1965 and then retired in 2004. And within that time, he saw the explosion of what best could be described as medical bureaucracy, and how this affected his art of healing and caring for patients. He also suggests a way in which we can improve our medical care across the United States. So stay tuned for part one, and after you finish watching part one, you can click on to part two contained within my channel. So without further ado, let's go to St. George's Church in La Cañada as I chat with Dr. William Babson. Rather than have me tell you about Jack's career, I think the first question is, Jack, let us know when you started, when you graduated from medical school, where you went to medical school, and a little bit about what your career was.
Well, Anthony, I've wanted to be a surgeon since I was 9 years old. My dad was a general surgeon in the city of Gloucester, Massachusetts. And I always loved reading books about surgeons, what they did. And that was, I was born in 1939, so I was 9 at 1948, and at that time, a lot of books coming out talked about how doctors got to their patients by horse or sled, or, they didn't have much they could do, but they made a real heavy effort to get to patients in the woods of Maine or in Newfoundland or Canada and so forth. So under my picture of the high school yearbook, I said I wanted to be a community surgeon and graduate from Harvard Medical School, and that's what I did. After medical school, which I graduated in 1965, that was the year Medicare first started its progress. I took a general surgical residency at a big city hospital in Richmond, Virginia, Medical College of Virginia, which was 5 years long. In between those years, I spent 2 years in the Army and even 1 year in Vietnam. In those days, in 1960s, general surgeons did most everything. And for 5 years, working in a big public city hospital like the Medical College of Virginia, we saw most everything. And we were up at all hours. It was like a Marine boot camp. If you could survive a general surgical residency in the 1960s, you were the top dog. A chief resident, which was the 5th year, had a lot of power and did a lot of surgery. So after that, after I left Richmond, Virginia, I went to Plymouth, Massachusetts. That was in 1972. And I went there as a general surgeon and loved taking care of people. It was my life's work, is caring for sick people using surgical techniques. And I really enjoyed it. At one time in I think it was 1986 or 87, I kept track of the number of hours I worked, either in the hospital or in the office. And that didn't include hours being on call, the emergency room. For a 4-month period, I averaged 78 hours a week. That's almost 12 hours a day, every day, for 4 months. You couldn't do what I did unless you really liked to do it. And I had a wonderful wife and family that allowed me to do this. So I practiced, joined many organizations, and had some interesting experiences. When I first came to Plymouth, they didn't have a good ambulance situation. The police they had these station wagons, and they would take the sick, disabled, or whatever from the streets or wherever they got them and put them in the back of the station wagon and hustle on to the hospital. And of course they might have had some first aid training, but they didn't have much equipment. In 1976, Massachusetts developed an ambulance law, which defined the training for the individuals involved, the kind of ambulance, and the equipment, what they could do. And they needed somebody to train the basic emergency medical technicians. So I got chosen as a young surgeon, and I worked with Howie Blanchard, who is the fire department chief for Duxbury, the next adjoining town. And over the next 5 years, Howie and I trained over 200 basic EMTs. They all passed the national exam. It was all voluntary. And then the town of Plymouth needed an ambulance committee, so I was the chairman of the ambulance committee. And they wanted to know how to proceed with the care of the sick and the injured. So I had to deal with the police chief, the fire chief, and none of them wanted anything to do with transporting the sick and injured. So I did a study involving all the surrounding towns in southeastern Massachusetts about how towns handled it, and made a recommendation that a private ambulance service would be the best. And so that's what they did. They developed a private ambulance service, and they still have a private ambulance service. We had a town meeting situation where every April I had to get up before the town meeting and talk to them. And before the ambulance law, the police never charged a cent for transportation. When we developed the ambulance service, it was $45 for a ride.
And what year was this?
That was in 1977.
Okay. So that's a fair amount of change back in 77.
Yes.
Yeah.
Yes, and I had to answer town meeting members who were quite upset because the second year went from $45 to $100, the third year to $200. And they were quite upset with me. But I had little to do with it because we initially had trouble with people wanting a ride to the hospital. Mothers with children who would want have children go, and they would leave children behind and so forth. So we were the biggest county in Massachusetts, 106 square miles. We needed a second ambulance. Then we needed a SUV with paramedics. And then we had a helipad. And a close friend of mine recently had to go to his wife had to go to the hospital. He lives a mile from the hospital. The ambulance cost him $1,000. And the American College of Surgeons were involved with developing trauma centers. And they started making these rules, these guidelines. And one guideline was all burns of the hands, face, and perineum should go to a burn center or a trauma center. Now, I'd been trained in a burn center and a trauma center. And I stood up in Chicago at the meeting when they promulgated this rule. And I said, don't you think you should make it superficial burns, deep second-degree burns, and let the local surgeon have some say about what he can do? And they stood up and said, no, we've thought about it, and that's it. Well, that mentality started taking over so that all burns went to a trauma center if the patient wanted to go, and all significant trauma went to a trauma center. 2 years later, they were going bankrupt and complaining about how everything was going there. And the local surgeons were happy. They didn't have to get up in the middle of the night to take care of these accidents. We were on Route 3, which was a big road going to Boston. So in their wisdom, they ended up with a far too expensive system because all trauma and burns would go to trauma centers. Now, I don't mean to say that trauma centers weren't good and didn't do a good job and saved many lives. it was good thing. But they did it wrong. And that's part of the problem with the expense today.
Right. Before we go to today, though, I'd like you to share with our viewers the cost of medical care when you started, and again, how it has risen, at least maybe from your own practice. Can you tell us that way?
Yes, I took care of everybody that needed my care. I never used a collection agency. When I first came to Plymouth, most people had health insurance. They could afford it. That was in 1972, 73.
Were these health insurance all privatized at that point?
Yes.
And were they offered through their company like we have today?
Yes, through the company, but also you could buy individual policy.
Right. Okay, same as
Blue Cross Blue Shield was involved then, and but most people had it, and I could take care of everybody and not get paid and still earn a decent living. And I always did that throughout until I retired in 2004. The last 10 years of my practice, more and more people in Massachusetts could not afford the cost of health insurance. The last 10 years, I estimated that I gave between $80,000 and $100,000 worth of free care. And, you know, if people could pay, they paid. If they couldn't, they didn't. The cost was going up double digit. And in, I think it was 1992, the Democratic National Convention was held in Boston. And I read the Boston Globe, the newspaper, and I saw that Blue Cross Blue Shield had donated $100,000 to the Democratic National Committee. And that was at a time their premiums were going up double digits every year. So basically the cost, we've outpriced ourselves, doctors, the healthcare system. And more people are getting left out, not getting needed care. And even with Obamacare, there's 28 million people that have no insurance, 20 million people that are underinsured. The bankruptcy rate today is over 60%, and most of those, what I mean to say, 60% of bankruptcies today are related to healthcare bills. And many of those have Obamacare, but can't afford the copays and the deductibles.